With many states working to slowly reopen amidst the ongoing COVID-19 pandemic, I wanted to just do a very quick, very basic video on the chain of infection, just to help people understand how infection spreads and also understand how all the things that we've been doing to prevent the spread of coronavirus have really helped flatten the curve and save lives, and hopefully so that you can understand how if you continue to do some of these things, even if you're getting back out there as your state is slowly reopening, hopefully you'll continue to do these things to help keep that curve flat and help save some lives. The chain of infection is a really simple way to think about how infection spreads, and putting it in the context of a chain makes it a little easier to see how simple things, simple interventions that we can do will help break the chain and prevent the spread of an infectious disease like COVID. The first link in the chain of infection is the infectious agent, and these are the bugs that make us sick. There are four main classes. Mostly we're familiar with bacteria and viruses. There's also fungus and protozoa. The next link in the chain of infection is the reservoir. The reservoir is where the infectious agent can survive and thrive and multiply. So basically, the reservoir is where it lives. Humans and animals, the air around us, surfaces, these are all common reservoirs that we encounter every day. And COVID is special because it's very hardy. It can survive and thrive in conditions that most infectious agents don't do so well in. The next link is the portal of exit. So infectious agents don't have legs and they can't just walk around and get from place to place and person to person. They need something to ride on, and that vehicle that they ride on is what the portal of exit is. And so generally that's moisture particles. So things like microscopic moisture particles that we exhale or cough or sneeze out. Also mucus drainage from our sinuses when we blow our nose, maybe the gunk that we cough up, that is all a portal of exit. Next is the method of transmission, which is how the infectious agent is passed on. There are several ways that can happen. Some infectious agents are passed on by contact transmission, so directly touching a body fluid with the infectious agent in it, or touching a surface that has had an infected body fluid on it. So if someone sneezes and it lands on their cell phone, and then their kid grabs their cell phone, and their child has potentially picked up the infectious agent by contact transmission. There's also ingestion, so eating something with the infectious agent in it. Droplet transmission is another method of transmission, and that's where larger moisture particles, they're still invisible to the naked eye, we can't see them, but they're a little bit bigger, and whenever we cough or sneeze, they are projected from our body and other people can inhale them, or they land on objects like that cell phone, and they land on something within 2, 3, maybe 4 feet of the person, and anything that it lands on is now contaminated. Then it also can potentially become a contact situation, not just droplet, we can breathe it in, but also it can land on something and cause a contact issue. And that's how COVID is spread. That's why it spreads so easily, because we can breathe it in, but we can also touch things with it. Flu is the same. It's droplet transmission. It spreads very easily because those droplets can turn into a contact situation when they land on objects within a few feet of the sick person. And then there's also airborne transmission. Airborne method of transmission is when the infectious agent is living in microscopic, again, we can't see them, but there's moisture particles that we exhale or cough or sneeze out. And those particles stay floating around in the air around us for several hours. And so whoever then comes into that enclosed area can breathe that in and pick it up. So measles is spread by airborne transmission. That's why it spreads so easily. Tuberculosis is another example of that. And under very specific circumstances in a healthcare setting, COVID can be spread by airborne transmission as well. But again, those are very specific procedures that are really only done within a healthcare setting, within the hospital. The next link in the chain of infection is the portal of entry. And the portal of entry is the way an infectious agent enters the new host. And that's essentially through holes in our body. So our eyes, our nose, our mouth, maybe even our lungs, our respiratory system can be a portal of entry. Any breaks or cuts in the skin can be a portal of entry, and so on. And finally, the last link in the chain of infection is a susceptible host. A susceptible host is really anyone, but it's especially people who are immunocompromised, Maybe they have chronic health conditions or poor health in general. Maybe they don't live a healthy lifestyle, something like that. In the case of COVID, it's all of us. We've never been exposed to it. We're not immune to it, and it spreads very, very easily. So now let's look at how to break the chain of infection. Hand hygiene is the most important thing that you can do to prevent the spread of infection and to break the chain of infection. It works at many levels along the chain. It works at many links in the chain. So, for example, if you open a doorknob and someone with COVID who sneezed on their hand had recently gone through that door, you touch that doorknob, it's now on your hand. If you wash your hand right now, you've broken the chain of infection. If you don't wash your hand, and then you grab your phone, and then you reach in your purse, and then your child grabs your phone from you, all of a sudden we've spread the COVID to our phone, to our purse. Now it's on our child's hand and everything that they touch. Had I just touched the doorknob and then performed hand hygiene right away, I prevented the spread of COVID-19. Wearing a mask can prevent the spread of infection, especially with COVID-19. If I am sick with COVID and I wear a mask, then I'm containing it. I'm preventing it from spreading on the surfaces around me or to the other people that come within a few feet of me to inhale those droplets. If I wear a mask in public and someone with COVID-19 is walking around, then I'm not inhaling it as easily. And if I wear a mask and someone else wears a mask, then we're definitely really elevating our game on that one. And that's why universal masking is recommended right now, because as states are trying to open up, COVID is still out there. But if we wear a mask, we are decreasing our chance of spreading that infection as easily. Other PPE like gloves can be very useful in preventing the spread of infection if you use them the right way. What I've unfortunately seen is that people wear gloves and they touch the doorknob and they touch the shopping cart and they touch their phone and they touch their water bottle and they touch everything with the same pair of gloves. And when you do that, you're not actually preventing the spread of infection. You're protecting your hands, but you're not preventing the spread. Cleaning surfaces is a really effective way to break the chain of infection in many places as well. So at your home, cleaning doorknobs, spraying them off, wiping countertops, cleaning off the shopping cart before you use it at the grocery store. When you do those things, you wipe the bug away before anyone can touch it and spread it. So again, cleaning surfaces, very effective. Covering a cough or a sneeze is also a way to prevent the spread of infection. When you properly cover your cough or your sneeze, then anything within several feet of you, it's not going to get those moisture droplets on it and contaminate those surfaces. So definitely covering coughs and sneezes is a very important way to prevent the spread of COVID-19. Scientists are working very, very hard right now to create a vaccine against COVID-19, and vaccines work against viruses in the last link in the chain of infection because they boost our immunity, and so we aren't a susceptible host anymore to that particular virus. There are other ways that you can boost your immune system and be a less susceptible host, things like getting enough sleep, eating a healthy diet, getting enough vitamins and minerals in your diet, reducing your stress levels as much as possible, and exercising are all ways you can help boost your immune system so you're less susceptible to COVID-19 and other infectious agents as well. Oh my, the social distancing and shelter-in-place orders. Y'all, it's working. I know it's really, really hard, but it is working. If you don't go out needlessly, you can't pick up the COVID and continue the spread of it. If you have it, you don't spread it to other people. But states are going to start opening up, and as they do, take it slow. As you do get out more, wear your mask, wash your hands, be smart about things. It hasn't been easy, but it was necessary, and it kind of still is a little bit necessary until we have a surefire way to prevent the spread with the vaccine, or until we can better quantify how many people have been infected so far. So if your state is opening up, or even if you're just jonesing to get out and about and see your buddies, try to keep this chain of infection in the back of your mind as much as possible, and think about all the little things that you can do to prevent the spread of infection. Stay well, take care. We're all in this together. Thank you for watching.